Hello, everyone, and welcome to the Quorum Podcast. This is where academic medicine meets remote, austere, and resource-limited areas. Welcome back to the program. This is Aebhric O'Kelly. This week, I'm with Giulio Novarese. He's an old friend of mine. He is a doc, a special agent at the Department of Justice in the U.S. He's on the emergency response team for the DOJ. He was a clinical director for Sam Medical and medical director for tons of different organizations. Giulio, welcome to the program.
Hey, thank you, my man. It's so nice to hear your voice. Very nice.
So tell us a bit about yourself and what keeps you busy.
Well, how many hours do we have? Because I, yeah,
About 40 minutes.
I know I didn't stop yet, but not a lot to say. But I escaped from Italy 35 years ago. I'm joking, I didn't escape, but they offered me a position here in the United States. I was already a physician, and before coming over here, I was with the Carabinieri, the law enforcement agency in Italy. At that time, when I left, I tell you, 35 years ago, there was a lot of work for the Carabinieri, especially if you wanted to work with special unit and going down south. With the where the mafia was. So it was a hot time. So when they offered me over here for a study and research, I was doing at that time a research on the micro lesion below the 5 millimeters on the liver, and this hospital in Chicago was interested, so they offered me to come. At that time, it was easier to come over here and stay. They offered me, I came, and then they offered me to stay, and I stay. So that's how I started over here in the United States. And a friend of mine was telling me, hey, I know that the U.S. Marshal is hiring, but the best suggestion would be go through maybe just the Department of Criminal Justice. So he was talking, but I didn't do it. And I was like, yeah, you know what? Hell, when I became a citizen, it was easier, opened many doors, and I apply. And at that time, I was in fit, not like now, broken down. And I got I got the gig that I wanted to do. I remember when I was a school, I saw a movie that was called The Fugitive. Do you remember, with Harrison Ford? And
I do,
and
yeah.
the U.S. Marshal said, "Oh man, if you're an Italian guy, can you imagine being a U.S. Marshal?" And that was my dream, and I was able to fulfill it. So they were special unit with them. That really helped me.
So how many badges have you earned? How many
Uh,
badges have you worn on your chest?
oh man, that's a tough one, because I still have one today, because I'm still active with the ERT team. The moment I cannot carry my gears, how many times they told me, "Hey, Doc, you need to carry your bag and your vest." I say, "Hell no! If I can't carry my stuff, I quit." So I still have my,
Hmm.
but I had one, two, three, at least five different badges, five different agencies that
Wow.
services, and it was a great big experience, because you really understand how people function, how agency functions, and the limit that some agency has, and how other agency are totally free. I mean, you can request and whatever you need, when you need it, and where you need it. So it was a great experience. I love it. Lots of
Hmm.
not mad vacation like yours when you were active duty, but it's how you learn the job. There's no other way.
When I was a deputy sheriff for the San Bernardino County, I did run into you federal types, and you guys would jet set in and take uh, one of our arrestees out of our hands, and then go away. And we're like, "Well, wait, we just spent all this time arresting this guy, and now you're off taking him. So where did he go?" So I only understand the county level, and you've got the federal. You've had 5 different badges
Yeah.
at the federal level, so your reality as a cop was way bigger than mine.
It was different, and I tell you, I mean, when you are a deputy sheriff in a county or in a city, you have so many limits. When you have a federal, you have your scope of practice open, wide open. So it's easier to work, I would say. In some areas, not so much. too too paper pusher, I would say, and for my taste. And I'm not an adrenaline
Yeah.
junkie. I'm not crazy or suicidal, but I like. I don't like to sit in a suburban 3 blocks away from where my guys are doing an entrance. That's why I always try to be. I went to SWAT school and I learned to be the number 6 in the stick, and I always follow my guys still today. So I don't stay in.
So you and I met, oh, well, 15 years ago at Deployment Medicine International,
Yeah,
working for Dr. John Hagmann.
yeah,
And you had been there a while. I got in was '05 or '06, I think I started, and worked until about 2013 as a part-time.
yeah.
But you were there a lot longer than me.
Yes, I did with John at least 16 years as a full time, and they allow me. With the nice of the agency where I was working for, they would allow me to go and do training and courses and teaching, and so it was great. Yeah, I remember when I met you. Yeah, it was a phenomenal. A great respect for John Hackman.
Yeah, we had, well, I mainly did the OEMS course, the 9-day course. And I must have, I don't know how many I did over the 7 years, probably 20 or 30, way less than you. But man, Julio, every time I sat in the back of that classroom and listened to the exact same lecture from Dr. Hagman, I would learn yet again something new. Like every time he talked, just the wisdom of medicine coming out of him was brilliant.
I cannot agree more. I mean, I sat in the back of that class for a long time, and same exactly experience. You always like, oh my god, why didn't I put more attention to this? That was different. Oh yes. Oh, so you always learn something, and I guess it was everybody because everybody was coming out always enriched with something new, something to think about. It wasn't always a closed discussion. It was always open to improvement, and he was open to improvement too. And the way how he was presenting uh, the skill of communications, I never saw anybody able to entertain so many high level standard trainees and trainers and make them wonder, oh wow, this is amazing, can I listen to this again? So
We'd have what 250 people in a huge hangar as students, and there was what 18 to 20 SF guys. We're all in the back,
yeah,
listening in or getting the suture trays ready or something like that. But it was amazing to see all these people riveted as he was speaking.
yes, absolutely. And remember the hands-on part. I mean, we were all engaged
Hmm.
helping the people to learn how to suture, to learn how to get an IV going. When everybody at that time was doing lots of theory, well, it should be here, it should be there when we were doing it. And I know for some people it was hard to understand why, but if you think about it, it's like, why do you carry these gears in your backpack and you dump tons of other stuff that your backpack came with? Because right? You make your own experience and then you trust the gears that you know how to use it. Remember, we all talking about it. All right, what do you have in your backpack? And the people were looking at you like, why? What do you have in it? And do you know how to use it? And they were like, oh yeah, I know how to do it. I remember, for example, a fast one event with some SF guy, and the guy, of course I have it. What do you have? I have a fast one. Do you know how to use it? Yeah, sure. And I remember to shoot the fast one. He he sat on the chest of the patient. Like, I'm like, well, and the patient was trying to suggest him what to do,
Wow.
and I was telling, hey, listen, normally the patient do not know what's going on, so I don't expect you to suggest your medic how to really do the IO. But he sat on his abdomen and he told me clearly that he knew how to do it.
Wow.
So there was always something to learn, always something.
This was where I perfected my teaching for the hands on skills. So, there's head knowledge and there's hand knowledge. And at DMI, we did both really well. So we would have the didactic learning interspersed with all sorts of interesting things like the hydration lab and things like that. But then
Yeah.
when just get to the hands on, that's where everyone learned. And if somebody does a fast one IO and they actually do this in real life, they'll always remember that.
Yes. I remember. I remember, for example, a group of physicians from Navy Special Warfare, and remember we were doing the little lidocaine wheel, so that
Yep.
the student not could practice more confidently and without pain. So I remember, and they were ensuring over and over and say it over and over that they could have done the little wheel with a 27 gauge needle on a rib. So, and
Wow.
John answer was like, okay, then let's do it. So we put two rib in the water at I don't know, 15 knots, high seas, the ribs going all over, and they were sticking each other with the 27 gauge needle all over their arm, and they finally reached the conclusion, well, I guess the IO is the only solution. Exactly. There's no
Mm,
other way that you're gonna do it something on a rib, or it was, again, it was an incredible learning point, because they were absolutely sure they could have done sedations, getting an IV going with a little or no pain using the lidocaine. So try to get an IV going on a rib, and sure, maybe you're better than me,
mm.
but it was impossible.
Yeah, those rib boats. I was on a Mare Ops team in Special Forces, and we spent tons of time on Zodiacs and on the water, and they just pound you. Your kidneys are hurting after trying to infill. I can't imagine even doing a fast one on someone on one of those, let alone trying to do an AC or an EJ. Yeah, imagine an EJ on one of those ribs.
Yes, good luck. And they were physicians, super trained, very smart guy, but they have no idea of what they were talking about. So the
Mm,
only way, and I think Doc has a great intuition to say, all right, let's do it. So the NSW put these two ribs available to us, and they fast learned the lesson.
mm.
You know, it has to be simple. And we almost lost Doc Hagmann on the way. I remember, there are those you hold yourself, and Doc would left go his hand, and we almost lost one of the Navy guy, recover him right on the side of the rib. Oh my God, I said it. Not lose Doc Hagmann in the middle of the ocean.
Wow.
By the way, your favorite place was
Oh, La Grazia.
Gracia. Yes,
So yeah, speaking
yes.
of Navy SEALs, we taught the Italian Navy SEALs in La Grazia.
Yes. What a beautiful place.
That is that that bay is stunning. It's like one of the most beautiful places on the planet.
Yeah, yeah, and for me it's special because my dad was a incursor during World War II on the opposite
Ah,
way, but he was an incursor, and all the way to the end, he was happy and proud. So that's
wow.
why the bond that we have with them was special, special.
Hmm.
I love them. They're super smart, super professional, and humble.
And we also taught the airborne in Siena in Italy, the Folgore.
Yep, Folgore, the couple of regiment we did. I would say, to be honest, many times when I talk to people, and we try to remember what we did, it's hard, even for you to think about it. All those years with deployment medicine, I mean, we train every SF you can possibly think about it,
Hmm.
from all the way to the east, all the way to the west, and every country. So it was great. We learned from everybody. We really learned from everybody.
Indeed. One of my favorite memories from teaching the Italian SOF was that you would have wine in the chow hall
Yeah.
for lunch. And then the MREs had a box of wine. And I looked at that and like, oh, it's going to be rubbish. No, it was a fantastic box of wine in the MREs.
Yeah, I think Italians are the only one they allow that on base. Remember, every time you can get your wine. There we go. Life
Yeah.
is short.
So you're living now in Virginia Beach, and that's also a lovely place.
Yeah, and it's convenient. Let's say all the agencies are around this area. NSW are right here, and NATO, the blue building, and the two command are right here. So, and it was a great place to grow children. My girls are still, well, I still think they're little, but they are now 14.
uh, it's a good part of the world to raise them. I deployed up to Fort Story when I was with Third Special Forces Group, and back when it was it was, I think it's Navy now. They've turned it over, but
Yeah, but they still army though. The village still there. Village where the army built it. Actually, it's still there. Every group go there, and now there are 2 weeks of big exercise. One started last week, and this week big exercise right on First Story where you were.
so looking back over your medical career, what's one or two patients that were interesting to you and you would be willing to tell the audience about?
It's hard to say. I remember when we were doing a job. Now it's so many years ago, so there's no any kind of interest on it. But we were doing a job, and that's and maybe you remember that story because that story came up even during my story came up during Doc lecture. He was talking about it. I didn't talk about it because I pooped my pants multiple times. But we were doing an operation. Nobody was supposed to be there. There were mud hut in a specific area in the south of the United States, and unfortunately, when you get intelligence, did you ever had Aebhric? Did you ever had intelligence that is really what it is? I mean, it's very hard.
No, not at
I
all.
The answer I think for everybody that did the job is like, yeah, no. Maybe. I mean, I'm not saying they don't do their job. I'm just saying, it's so easy and complicated. There are so many variants, and things are, very mobile. They're not stable. Things change. But we were told there was nobody who was able to go and set up an area where we were able to eventually ambush the drug cartel people that they were supposed to recover some stuff that was in this field with this mud hut, and one of the, let's say, scout that was working with us was not wearing a plate carrier. We're not wearing uh, anything except a cowboy hat, I guess jeans and a t-shirt. And he opened the door, say, "Entras," and when there is nobody, and he gets shanked. Well, the bad guy got, of course, neutralized by the assault team that was right behind. But this guy, is on an initiative, opened the door, and he got shanked. And I remember getting in, and he was talking. He was talking. He was talking to me. I can see a little small incision because it wasn't a big shank. It was like more like a piece of steel cut it like a 45-degree angle. So it penetrate. But it was hard for me. Blue lights, because you could not turn on lights, blue lights and this and that. You remember that stuff. And night vision was no question. I could not even use it. So we were using the blue lights at that time just to see better. And I see almost no blood. But I see this incision. I open his shirt and I see this cut, and I tried to figure it out what was going on. And he looked at me and he stopped talking. He go down. I touch his pulse, and he has no pulse, no heartbeat. I said, "What?"
Wow.
So the decision was made. We're gonna try to see if we can open his chest, and we decided to do it. The pericardium sac was so full, and the moment we did a little nick on the pericardium sac, the heart restart, and he was already into my paramedic already intubating him. So he has to extubate him. Man, he was looking in my eyes, and I remember telling him, "You're gonna be okay." He passed out again,
Wow.
but we got a heartbeat back. So now I got a guy in the middle of nowhere in a mud hut underground. We were able to again to sedate him with the rapid sequence intubation. We intubated him, and then my paramedic, there was an 18 Delta, was keeping him alive. I was trying to patch somehow this little problem that we had, and we did a medevac, and the guy is alive and kicking. All the thing that followed that, when at that time I wasn't the medical director, I was just one of the operator with the guys, and my boss was he tried to kick my ass out of the team big time, but everybody wrote a recommendation letter to say, hey, this guy would not hear if it wasn't for Doc G, blah blah blah. But he tried to cook me because, let's say, I didn't use a perfect sterile protocol.
Yeah. Yeah.
And, why you didn't use this surgical set? Why you didn't use, when you're not there and you're on your knees in a mud hut with a blue light on your nugget, it's very hard, you're right? I thought he died because I thought that's the problem. I got a decision. We're going to open his chest. I know the risk. I know everything that was going on, but I had, one in a
Mm.
million time to get intuition. It was right. And but see, I didn't talk about it for the longest time because I didn't want people to think, "Oh, that's the right thing to do." Hell no! I mean, I'm the first one that I said, "Oh, I'm gonna lose my license. Thank God, I'm dead. I have family. I would be fired." But then, well, they didn't fire me; they fired him.
Mm.
So I became the
Huh.
medical director. so,
Wow.
but the best for me was to know they didn't allow me to contact this guy for the longest time because they had a big investigation on it. But he's alive today. So, and that's you asked me. That's you want a strange one? That's a
That's
strange one.
incredible. Of course, nowadays we have ultrasound that you could have used to quickly ascertain attention.
Yeah, at that time, I, it wasn't even a thing. I mean, the ultrasound was a Itachi, or you remember those big machines on the wheel that looks like Wally.
Oh, yeah. Big as a
There was
car.
no
Yeah.
portable. Oh, the portable was a giant computer. I mean, I had a M9. I have an M9, and if you remember, I designed a small surgical rig that I was able to put in front of my vest that I could release if I needed. But I have my surgical instrument in it in the front, and we had syringes with ketamine and lidocaine and all that ready. But I have very limited resources. I know it was crazy, but the guy was already dead. So I said, if you think I feel responsible because I was not able to bring my wife home 4 years ago uh, for something that I thought it was absolutely all right, we're done. I can bring her home from the hospital, and I couldn't. So I feel guilty for that because I was able to save somebody in that condition, or a guy with multiple
Mm.
gunshot wounds, and I could not bring back home my wife from a super fancy hospital that I think did a big mistakes. But
That's devastating, brother.
uh, it was and it is. Plus, I was not designed to be a full time dad. So, from rock and rolling around to all of a sudden you have to come home and tell your daughters that at that time were
Mm.
10. Uh, Preparing, all the sign on the wall, we love you, welcome home, and not bringing her back. February 14,
Wow.
2000. Yep, that was my other crazy patient. I will tell
Mm.
you, she crashed in one day, and still today, I feel responsible. I know I wasn't. She was not my patient, but I feel responsible. I didn't understand what was going on, and how I let it go, and I think they did a mistake. She needed an NG tube at 5 o'clock in the morning. I could not grab mine. I didn't have my
Mm.
pet bag. Uh, they were giving her fluid that is not
Wow.
tomorrow. tried to put an NG tube when her stomach was full. So imagine what happened when they lay you down and you're
Mm,
vomiting. So
yeah, that's tough. Tough looking back and seeing what minor changes could have been made. Yeah.
yeah, yeah, yeah,
Wow.
and still today keep me up at night because I see her eyes. I see. I should understand. I should understand. That's what I say. I mean, a straight gunshot wound, sure, it keep you busy. You may lose the guy, but I think as a define history, you know what happened, you know what can happen, how it can go. When you have a, chapeau to all the clinicians that have to understand things that everybody can tell you. I have nausea and my belly hurt.
Mm.
Oh, guys,
Ev-
what we do now?
Everyone likes
Where we start?
trauma. Yeah, but it's the non-trauma,
Yeah,
the disease and non-battle injuries that
yeah.
everyone needs more experience with.
Right. I remember we were even doing classes on the diarrhea in the deployment setting and how people were getting dehydrating, losing salt, and this and that. But I never had a class on constipation. Sorry, but for me, I had more people constipating that we have to send it back because they were sucking on the silly MRE cheese thing that diarrhea. Diarrhea, we know how to treat it and we stop it no matter what. But when you're constipated for weeks, so that's again something that you know we learn it because you learn it with your boots on the ground. There's no way.
Heckman talked about a lot of those disease and non-battle injuries. One of his first lectures that I listened to, he talked about the cholera patient in the bathtub, and he said, if there is fecal matter on the ceiling, it's cholera. There's just no questions on that. And I never forgot that. It's fantastic.
Yeah,
And he was talking about DNBI and prolonged field care. I was thinking about that, and I was looking through some of my
yeah,
notes that I took in 2005 from Hagmann. He didn't call it prolonged
yeah,
field care. It was uh, AFIT arse, I think he used as a mnemonic.
yeah.
So, but he was,
Even mnemonic. Yeah,
yeah.
remember? Try IEO.
Oh yeah,
Remember we come out with all
tips
those
to try
mnemonics.
IU tips. So yes, yeah, that's
Yeah,
right.
yeah.
Um,
Yeah.
so
But think about it. We were talking about prolonged field care in 2005.
yep.
All those nursing skills that people were losing. The solution to pollution is dilution. Do you
Mm,
remember?
yep.
That was Shorty.
Yep.
That was Shorty.
Yeah.
And they bring on. Remember the old video,
That's right.
Vietnam era
Yeah.
video? They were
Delayed
washed
primary
over and
closing,
over.
and yep. Wet to
Exactly.
dry
Exactly.
dressings, and of course now there's
Yeah.
wound vacs that have a lot of research that help
Yes.
with that.
Beautiful.
Yeah. At the SOMA conference,
Yeah.
I'm running a improvised medicine workshop with Paul Lose and Mike Schertz, and we'll be talking about
Oh,
an improvised uh, a wound vac, using a Toomey tip syringe and oxygen tubing.
That's remind me the old DMI time we were learning and practicing tons of stuff. Remember the squeegee with
Oh,
the foley down
yep,
the airway to clean the mucus?
yeah, yeah.
You put a foley in somebody's airway? Yep, and it works like a champ. Just cover your face when you come out because the mucus will hit you right in the face.
That's right. A clean Foley, though.
Clean. Yeah, clean. I mean, I'm not going to take it out of somebody. I try to keep it clean. Yes.
Yeah.
Or I remember that a sterile gauze on a turd on the ground is not going to sterilize the turd.
Oh, that's right.
That was the other.
Yeah, it's about packing a wound. Like, people weren't packing a wound because they didn't have perfectly clean Kerlix, and it doesn't really matter, does it? Yeah, minimum better best, isn't it? It's you want the best, but you don't always have it.
Right. And it's good. If it's good to drink it, you can use it to wash the wounds.
So you've created burns courses for the Vatican Quick Reaction Team, or what? What?
So I create these courses like ultrasound, it's hands on. I mean, you do tons of, like yours, tons of ultrasounds. I have a professor, and she was the physician in charge. Guess when Nice has the terrorist attack on the Promenade des Anglais, it was her first. It was her first day working in Nice. She's an Italian doctor. I love her, Dottoressa Zennaro. I love her to death. So we come up with a star course. We come out with a ultrasound advanced 75 fast 757, and the burn and the monitoring of the patients and how to move the patient. So something something different. And from that, I designed the burn course, especially, let's say there are so many white phosphorus ordinance that are lost. Well, they say they're not lost. I would say misplaced, that they're starting to come up around the specific area, and people really don't know how to treat the white phosphorus injuries, uh, or the chemical injuries, chemical burns, electrical burns. During one of my consulting job, I worked for motorsports, and I was the medical director for a company called MDD Motorsports, and I learned a lot because I was doing the world championship of solo seater electrical cars. So that allowed me to learn a lot on electrical burns and safety about electrical. So we have a course as well on the electrical injuries and burns. So I try to create something that is a little bit not the same. You know what I mean? There are so many good people that train and teach so many wonderful courses like yours on tropical medicine with Shorty and you. I mean, I think it's phenomenal. But you are already doing it. So I wanted to do something a little bit different, and maybe fill some of the gap, maybe more specific that we were requested. In Rome, the Vatican will have the Jubilee in 2025. They're expecting millions and millions of pilgrims, and they asked for help to gate 757, and I was super stunned and happy to help them out. And then through that, we start to open a new connection with other police forces and NATO forces, uh, because they were interested as well after they saw a presentation that I did in a convention. And so it's that's why I did it. I don't want to compete with anybody. You know, there are so many smart, intelligent people like you out there. I just want to do something different, and some courses for everybody. Like for example, there is not a specific course for high school students. You know, we have so many issue with guns, and I love guns. You love guns. Everybody. It's not the gun the problem. It's mental health. We know that, but I mean, if you put a set, a tourniquet, and a hemostatic agent and pressure dressing in a school, well, people should don't you think should know how to use it? And they don't. I mean, they put the bag close to the defibrillator. Then maybe just few people are certified how to use it. When the defibrillator new generation, I mean, it's dummy proof. It tells you exactly what to do. I mean, sure, if you're trained, great. If you're not, open the box, turn it on, and listen to what it tells you to do. But beside that, if you have a bag with pressure dressing and hemostatic agent, uh, you know, pressure dressing, you better know how to do it, or you're just what you're gonna do with it. So we decided to do that, and we come up with a high school course, and now it started again. Luckily, I have this great connection with Sago Medica in Italy. That in the pre-hospital setting, even the hospital, but in the pre-hospital setting, I think they're the biggest company that can provide pre-hospital gears and stuff, and they understood that you can sell a rigid, you can sell a soft collar, a rigid collar, but if you don't train them how to use it, it will just be another thing in your backpack. They will stay there forever, and you will never use it because you are not familiar with it. So when they sell any device, they provide training. connected to it. And I think it was very important. So we started with some high school, and now we got 25, 26 high schools, 4 high schools. So that they already did the course, and they're going from one region to another region to another region, and I'm very proud of it. It's something new.
So, speaking of the Vatican, when we were teaching in Italy in 2014, you said that one of the physicians was the physician to the Pope.
Yes, yes, he's now in Iraq with he got a contract with the Italian defense, and now he's in Iraq. He was one of the elite surgeons of the Gemelli Hospital, because in the as you know, the Gemelli Hospital in Rome, it's the Pope Hospital. He has his own floor,
Hmm.
and yes, he was with us.
Oh.
He came to visit.
So, and you've been there many times. How many times have you met the Pope?
Not he's a super busy guy. I met probably more. He's a personal assistant, his nurse, the stay with him 24/7. But I met him three, 4 times.
You're an amazing individual.
No, it's unreal. I tell you, I was talking to him, and I was like, "What I'm doing here?" This is like, oh my God. I mean, this is, the second guy after the big guy, whatever you believe or not. And
Yeah.
it couldn't be easier. It was very, very lovely and understanding. This guy is a very nice kind of guy
Hmm.
when he's not in pain. If he's in pain,
Oof.
he's not a happy camper. I'm telling you, there's a friend of mine. He's one of the intensive care unit guy that works with him, and when he's not happy, he lets you know
Hmm.
he's not happy. So he's a patient like everybody else. That hurt. He's not afraid to tell you.
Fair enough.
I was feeling better earlier. so,
So,
so
Giulio,
you know,
my final question for you is what advice do you have for the new paramedic, the new nurse, the new doctor who would be interested in doing work in the austere environment like you have?
oh man, my suggestion is doing it. There's nothing more rewarding that work in the austere environment that we choose. That with very limited resources that help you to improvise, but not in a silly way. Remember when we heard the story of the SS guy that put the brakes on the femoral bleeders, and we
Mm.
said, may not be. We're not going to talk about it because somebody's going to do it. It's not going to go right. If you go right, you're an hero. If it doesn't go right, you're an idiot. So we're not going to talk about it. But improvise in the austere environment just to help a guy that has no possible outcome and know that you're going to keep him comfortable. And my suggestion is, if they tell you no, you can't do it, there's no money in it, just BS. I mean, do it, because I think I will never go back. I will never be able to say again in my life. And now I'm ready for almost for me to go fishing, but to say hello, good morning. My name is Dr. Novarese. I'm going to be your surgeon today. We're going to remove your appendix. Screw it. I ain't doing that. I rather get in a gunfight and then take care of business.
Mm.
And you know what? These nurses, these young physicians, that they will follow what we did for 35 years, 40 years, will just do it better. They will have more capability than we did, because hopefully our experience will be something that they will be able to use. I don't commit some of mistake that maybe we did with the saline solution and the high fluid resuscitation.
Mm. Yeah, too large
and
for IVs. Yeah, we don't do that anymore.
hey, you know what I mean? We did it for so long, and that was, uh, you cut blood pressure lower. Anesthesiologist was raising your blood pressure, say, to standardize it. Standardize it to what? His standard or your patient's standard?
Mm.
So we learn so much, and we use it. And I would say just, and it's so important to practice. Just don't read book. I mean, there are so many people that are awesome uh, in just paper knowledge, but if you tell him do an IJ or do a arterial hemogas analysis, get the artery, what? Or do a femoral
Mm.
block without ultrasound. Remember, we were doing femoral block, deep
I did
anterior.
on the streets of Johannesburg without an ultrasound. Yeah.
Exactly. Exactly. And we still do it, the brachial transarterial. It's phenomenal. If you can teach it, people will retain it. And or surgical airway, people freak out. And we're like, how many we did it?
Mm.
Millions of those. So teaching is like, okay, well, feel the mount, the valley, the plateau. In the valleys where you cut. Uh, it, you teach it if you did it. I think at time there are a lot of people that teach that they never did it, and I think it got more complicated to understand when you are a young doctor or young nurse or PA, that, to learn from people that never did it.
Mm.
You did it. Shorty did it. Mark Di Pasquale did it. All the guy they work with you know for a fact they did it. They don't have to invent it or think about it. And I think that's what I hope the new people will do it.
Good advice, Doc. It's great to get you on the podcast. I've been looking forward to this for ages, mate.
Oh, you are too nice, as always. And let me know when you come and see the guy in white.
This has been a presentation from the College of Remote and Offshore Medicine. If you would like to earn CPD credits for this podcast, you can join the Council of Members. Being a member of the college gives you free CPD credit, free access to our virtual field guide, and discounts on our e-learning courses. You can join the team on our college website at quorum.edu.mt.